What's syncope? Fainting. Okay? That's syncope. You suddenly faint. Okay, that's the medical term. Remember guys, you're future doctors. You should start using medical terms. Oh my God, I'm going to syncope when I see that. Okay? And then you'll start using the word toxic. I know. Have you already started using the word toxic yet?
Yes.
Right?
You generally do it in the 4th year.
Right, yeah? It's like, oh my God, I'm so toxic. And then suddenly when you go to the clinics, you'll start, instead of typing the word patient, you'll type the word PX. Oh, I have a PX. The PX is here. Instead of treatment, you'll say PX. Right? So get used to it. Okay, the medical profession has tons of terminologies and abbreviations. Okay? So, these are the causes, again, of atrial tachycardia. Now, when you say something's idiopathic, what does this mean? The cause is not known. In other words, we're idiots. We don't know what caused that particular thing. That's why it's idiopathic. Okay? So, an atrial paroxysmal tachycardia, take note. Normal, 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 and then tachycardia. Okay? And now, and then after this could actually return to normal, but suddenly there'll be a long pause. When you say a long pause, when there's no electrical activity, what do you call that?
STC.
What's that?
STC.
ST segment? No, the ST segment is the S between the S wave and the T wave. When you say no electrical activity, what?
Stroke syndrome.
Slow. What's that?
Stroke syndrome.
Stroke syndrome. No. Okay, you guys are thinking too far ahead. You've seen this on TV, right? Assist to it. Okay? When there is no electrical activity, it's called assist to it. It's always common, especially in Filipino dramas, right? No, we're losing him. We're losing him. Shock him, shock him. So from assist to it goes back to normal sinus rhythm. By the way, we'll learn about this. You do not shock assist to it. Yes, you only see that on TV. It's not true. Okay? Okay, let's cross over to pharmacology. You're saying, what? We're going to learn about pharmacology? No, just one drug. Okay? We'll talk about digitalis or digoxin. Okay? Digoxin, Filipinos pronounce it digoxin, Americans pronounce it as digoxin. Okay? So, digitalis, purpurea, or what's called the foxglove plant, this is what it is. Okay? It's used to increase cardiac contractility. Okay, so we call this a positive neutral drug. It increases the power of contraction of the heart. Okay, sometimes there will be conditions where you need a more forceful contraction of the heart. It's used to control heart rate, particularly in irregular and often fast atrial fibrillation. So things like atrial tachycardia, atrial fibrillation, you can actually control it with drugs before resulting to defibrillation. You don't need to always shock the patient every time. You'll learn about indications of when to shock patients. Okay? But you will start shocking patients in 4th year. Oh, by the way, on TV you see when they shock patient, the patient like rises about 3 feet off the bed. It's not true. Okay? That's not true. That's exaggerated. It's like, boom. Right? The patient goes up this high. Okay? It's not true. Usually when you shock the patient just does this. Sometimes the arms just flail. Okay? Nurses here know what I'm talking about. Okay? Okay. Now, the problem is if you have too much Please note this in medicine as well, or in life. Too much of something is never good. Too little of something is bad, but too much of something is not good at all. And in this case, if you have an overdose of digoxin, you will have what's called digoxin toxicity, which is, well, they're not specific, but blurred vision, change in color vision, what's called yellow vision, anorexia, nausea, vomiting, diarrhea, abdominal pain, headache, dizziness, confusion, or okay? So those are the things you'll see in digoxin. The problem is, the characteristic ECG change of a digoxin toxicity is bradycardia and a very prolonged PR interval. That's the reason why when we interview patients with a prolonged PR interval, we actually rule out other causes. No other cause can be ruled. One of the causes we rule out is digoxin toxicity because it is a very common drug. Okay? It's not, well, it's not over the counter, but it's a very commonly used drug in cardiac treatment. So when you say a junctional rhythm, does anyone know what a junctional rhythm is? It's a rhythm that originates from the AP node. Remember, the AP node is called the AP junction. That's why junctional rhythm. Okay? So an accelerated junctional rhythm or bidirectional ventricular tachycardia will suggest digoxin toxicity unless proven otherwise. So that's one of the first things we start to rule out. If the patient is taking digoxin, why the patient is experiencing that type of rhythm. Okay, so mechanism of action. It can either increase the vagal tone. When you increase the vagal tone, what happens? You have more acetylcholine causing a parasympathetic effect causing bradycardia. Okay? Or you could have what's called an electrolyte rearrangement, meaning an increase in calcium. And an increase in calcium will cause tachyarrhythmia. So that's where digoxin can either cause a brady or a tachyarrhythmia as well. Okay? So what we don't finish now, we will continue again on Tuesday, right? We don't have class on Thursday, right? Yeah, yes for me too. Yeah, so I get to rest. See how big my eye bags are.
Supraventricular tachycardia, also called SVT, is a relatively common diagnosis in the pediatric population. It's estimated that about 1 in every 1,000 people will have SVT. If SVT is diagnosed before 1 year of life, there's about a 50% chance that it could spontaneously resolve. However, if it is diagnosed after that age, then it is unlikely to resolve. Supraventricular tachycardia generally has symptoms such as palpitations, often with a sudden onset of fast heart rate, shortness of breath, sometimes dizziness, and occasionally patients can have fainting episodes. In some patients, these episodes may be associated with exercise, activity, or with caffeine. Supraventricular tachycardia occurs due to an abnormal piece of muscle in the heart allowing electricity to loop. This loop of current causes supraventricular tachycardia.
To show you an animation of a common type of supraventricular tachycardia, follow me to this ballfix.org animation. Normally, the electricity in the heart starts at the sinus node. This electricity then passes through the atrium to the AV node, seen here in the middle of the heart. The AV node is a bridge between the top and bottom chambers of the heart that acts like a toll bridge. It receives a signal and sends it to the ventricles. In a common type of supraventricular tachycardia, an electrical signal passes through the abdominal muscle within the heart, causing the heart to beat quickly. This extra muscle, in this case seen as the accessory pathway, can allow electricity to loop back again to the atrium and return to the AV node. The AV node passes the signal back to the ventricle, which can again loop back to the atrium through the accessory pathway and again to the AV node. As you can see, the heart is no longer under control of the sinus node, but under this loop of current